What if the test that qualifies you for treatment only looked at the past? That's exactly the situation with most current genetic tests performed before a patient receives a DDR inhibitor. These tests search for mutations like BRCA1 or BRCA2, or for something called a genomic scar, a trace left by past DNA repair failures. The problem is, these signs only reflect what happened in the past. They don't tell us about the tumor's current DNA repair capacity. Plus, they miss other mechanisms that affect treatment response. That's why today's biomarkers have limited accuracy in predicting who can truly benefit from DDR inhibitors. What we need are tests that reflect a tumor's current response to damage, tools that directly measure its ability to fix DNA. These are functional predictive biomarkers, and they're the future of precision diagnostics. IntoDNA is helping build that future. Want to see how? Let's talk or check out our next video.